In today's video, we're going to talk about congenital lacrimal duct obstruction. Let's dig in. Congenital nasolacrimal duct obstruction, just from the naming, this is congenital nasolacrimal duct obstruction, meaning that you have obstructed the nasolacrimal duct, and this is a duct that drains tears from the lacrimal system to the nose, so from the lacrimal sac to the nose. So when we have that obstruction, then in congenital we'll call it congenital nasolacrimal duct obstruction. So it occurs when the nasolacrimal duct, which drains tears from the eyes into the nose, fails to open properly at birth. And the reason behind this is because we have delayed canalization of the near valve of Asna. So at the inferior end of this duct, we have a valve that is called the valve of Asna. So when we have delayed canalization of this valve, then we can have congenital nasolacrimal duct obstruction. So, and therefore this leads to tear retention because we cannot, there's defective tear drainage. So we'll have tear retention, excessive tearing, that is epiphora, and sometimes this can lead to infection. So when it leads to infection, then when you do on pressure reflux, you are going to have purulent material from the punctum. And it usually affects about 50% of the newborns. So signs and symptoms they usually present from birth or within few weeks after they have been born. And the reason behind this, we say this is a congenital disease. So as we said before, you're going to have epiphora, and this is excessive tearing. You're also going to have mucopurulent discharge, and this is to steatosis and secondary infection. And you're going to have a swelling at the middle cancers if the child develop dacrocystitis. Management: massaging of the nasolacrimal duct and antibiotic drops 4 times daily because of the infection. And this usually improves by the age of 12 months in 95 of the cases. However, for the cases that does not improve, then you probe at 12 to 18 months. And this probe usually causes 90% of the cure for the first probe and 6% by the second probe.